All right, good morning, everyone. This is the Texas Early Learning Council meeting. It is 11 a.m. And I'm calling the meeting to order. I'm Reagan Miller, the chair of the Early Learning Council and the director of the Child Care and Early Learning Division at the Texas Workforce Commission. We're happy to have all of the members here who could join us and public members who are listening in as well. So as a reminder, we are producing this as a Zoom webinar, and all of the members, agency staff, and presenters are participating as panelists, and the public is able to participate in a listen-only mode. I want to remind all of the members and panelists to keep your Zoom meeting muted when you're not speaking. And if we forget, Megan will mute for us. And please try to remember to state your name each time before you speak. A few housekeeping things on public comment. The public did have an opportunity to submit written public comment until 5 p.m. yesterday. The public is able to request the ability to speak orally today. And so if anybody else, I believe we have one public comment. If anybody else would like to provide public comment today, you can email your request to Megan Schneider, and she has put some information in Zoom in the chat, so you can see that. Okay, and with that, I will ask the members to take a look at the January 2022 meeting minutes. Those were included in the email to you, as well as on a calendar attachment that you have. And I'd like to see if there are any edits or changes to those draft January meeting minutes. And hearing none, can I get a motion to approve the meeting minutes from January 2022?
This is Kim Crawford. I will move to approve.
Thank you, Kim. And do we have a second?
Alferma
Second.
Alferma, thank you very much. And with that, Megan will conduct a roll call vote, which will also be our attendance. Megan, to you.
Great, thank you, Reagan. This is Megan Schneider, the meeting facilitator. So when I call your name, please just say for, against, or abstain. Catherine Abba.
For.
Sarah Abrahams. Travis Armstrong. Weldon Beard. Terry Breeden.
For.
April Crawford.
For.
Rochelle Daniel. Alferma Giles.
For.
Melissa Hoisington.
Abstain since I had to miss the meeting.
Okay. Becky Huskeeler.
For.
Kim Coffrin.
For.
Jerletha McDonald.
For.
Dana McGrath. Reagan Miller.
For.
Teresa Robledo.
For.
Stephanie Rubin.
For.
Amber Sconlin.
For.
Kirsten Schwab. June Yateman.
For.
And Audrey Young.
For.
Great. The motion to approve the minutes has carried, and we also met a quorum during the roll call. So I will pass it back to you, Reagan.
Fantastic. All right. So with that, we are going to go to our third agenda item, which is public comment. Going to turn it over to Megan to facilitate. I do understand we have one individual who would like to provide comment. Megan, over to you again.
Great. So as a reminder, the Texas Early Learning Council's website, which is earlylearningtexas.org, has a section called meetings, and that is where you can find all the information for past and upcoming meetings, as well as the agenda once it's released. Public agendas are posted a minimum of 1 week prior to the meeting date, along with instructions for submitting public comment. So we did receive one request to provide oral comment. So you didn't receive anything written in advance. And that her name is Bridget Tobin. So Bridget, I'm going to promote you to a panelist, and then you should be able to speak to the council. And I apologize, but I actually don't see Bridget on. So Bridget, please just drop a note in the chat if maybe your Zoom name is something different than what we were expecting. I see Kathy McCourse raising her hand. Kathy, I'm going to allow you to talk because I'm guessing that that is perhaps actually Bridget. So you should see that promotion to panelist in just a moment. And go ahead and start talking when you can. You'll have 3 minutes and you'll hear a 2-minute chime at the 2-minute mark.
Hello, is this?
Yep, we can hear you. Yes, you look like Kathy
Okay.
McCourse in the Zoom, but go
Okay,
ahead.
strange. Yeah, this is Bridget. Hi, my name is Bridget Tobin. I'm here to speak on item 5 on the federal stimulus funding. And I'm a master's in social work student at UT Austin, and I'm really interested in early childhood education. So I'm just here today as a private citizen. I, like most of you, am very excited about the work of this body and the Texas Workforce Commission to approve the $2.45 billion in the ARPA funds last fall and the additional $1 billion in COVID stimulus funding from February, all being dedicated to the Child Care Relief Fund. So I want to thank you for your work in making sure childcare providers are being uplifted, especially at this time. And I think we all know the state of staffing and recruitment in this field, and so much so that it's being called a national crisis. So what I also want to highlight is how important it is to think of these funding changes as long-term and something we need to make sustainable well beyond a public health emergency or an economic crisis. Childcare workers have needed an increase in pay for a long time. I heard some of the comments from the January meeting, and the message was pretty loud and clear that everyone seems to agree that we want to find ways to increase provider pay while also keeping tuition affordable and the care accessible to as many families as possible. I'm really glad that there was enhanced funding available for providers that are Texas Rising Star certified, and also that you're providing that enhanced funding for facilities and childcare deserts, and also for people with high social vulnerability index scores. So due to the seriousness of childcare deserts and the lack of childcare access for low-income families, I would just encourage, if at all possible, to increase that enhancement amount, or to just keep that in your mind, to increase it higher than 10% whenever possible, to really support those providers who are serving these kinds of communities and their recovery and reopening, especially the social vulnerability index score. Is specifically designed for communities identified as the most under-resourced and exhibit social conditions like high poverty, low percentage of vehicle access, and crowded households.
You have 1 minute.
Okay, which make it really hard for them to recover from financial loss in the event of any kind of disaster. But in order to get workers in these areas, we need to support them through this economic recovery, but also in the long term, so that they cannot be as vulnerable over time. So when every community is struggling, like we're seeing right now with staffing shortages and providing a competitive wage to childcare workers, we know that the providers and the children in these communities and zip codes are even more likely to not have their needs met. So just a few more comments about childcare workers' wages. I know there's been some work to try to increase this, and there's still a lot of work that needs to be done. A study from 2020 found that the poverty rate for early educators in Texas is 18.6% compared to for K through 8 teachers. It was only 2.5%, and the general worker percent was 9%. And on Indeed.com, the listed average salary for childcare providers in Texas is $11.27. Which is listed as 16% below the national average. And based on 11,000 ratings on Indeed, childcare providers, and 33% of childcare providers in the United States think their salaries are enough for the cost of living in their area, which means about 2/3 feel that it is not enough. And in Travis
And I'm going to have to stop you. I'm so sorry. That's the 3 minutes.
Okay, thank you.
So Reagan, I'll pass it to you. And if there are any questions from the council, and that was our only public commenter.
Okay, thank you, Megan. Any questions or comments from council members? Stephanie?
Yeah, I just, thank you very much for your comments. And you mentioned something called a social vulnerability index, which I was not familiar with. And so I linked to the CDC site, which explains that, which I think is really interesting. Hopefully that's the right index that you were referring to. If not, feel free to send Megan a link and we can post that, because I think that's, an interesting way to, look at whether our programs are reaching the families that need the most, and same with the providers too. So thank you very much.
And Stephanie, perhaps we can ask Allison Wilson, who will be presenting for TWC on our stimulus update. One of those updates is on the $3.45 billion that was approved, and the social vulnerability index was one of the criteria that was used in the distribution of those funds. So we can talk about that a little more when we get to that agenda item.
Perfect.
All right, any other questions or comments from council members? I want to thank our public commenter for being here and for providing comments to us today. We always like to hear from the public as we continue our work. So with that, we are going to move on then to our fourth agenda item, and that's a discussion of the data roadmap work group. So last time we met, we had a discussion around our interest in early childhood integrated data systems and developing this roadmap for Texas that could help inform future decisions on how we might be able to link data across programs to get a more comprehensive view of early childhood services, the kids and the families that we're serving, and outcomes. This was one of those areas that was identified in the strategic plan that the council developed. And council members have been discussing over the past few meetings how we do want to see if we can do some additional work around data integration efforts. So last meeting, we asked all of the council members if they'd like to volunteer to participate in a work group of this council specifically on data. And we had, gosh, how many did we have, Megan? 7?
There's 7. Mm-hmm.
We have 7 council members or individuals from the organization that the council member represents who have agreed to serve on this new subcommittee. As chair, according to our rules, I have the ability to name a chair for this new committee. And so Sarah Abrahams will be chairing this data work group. Sarah's a little late to the meeting today. She had a conflict. She should be joining us very soon, but just wanted to make sure that everybody knew that Sarah Abrahams was chairing. And then you'll see on the chart the members. So we have April Crawford, David Fagan, who is representing Texans Care for Children, Kim Coffrin, Kirsten Schwab, Laura Varnell, and Allison Wilson. This work group is going to meet for the first time on April 6th, 9 to 10. You'll see that we noted this is open to the public, just like our meetings are. So anybody can sign up to attend on the Texas Early Learning Council website meeting page. And as always, the public is welcome to provide comments at this meeting as well. Stephanie.
Yes, we look forward to this. Thank you. And I would just, given the data questions a lot of us have had, and integration challenges, I hope there's somebody at HHSC and TEA who will participate also, because those are sort of the big enchiladas in terms of integration with TWC and so forth. So I would just encourage the other agencies to put somebody on the work group too.
Yeah, and I will tell you that separate from this work group, we also have our interagency meeting between the early childhood agencies, and this is always a topic of discussion. So even if they're not formally on this work group, we are continuing to have discussion, and Sarah and Allison would be updating us on all of the work of this work group, because you're right, it's this work is going to impact all of the agencies as we look forward to data integration. And I do see a comment. Dana, thank you very much. Dana Perez is going to look and see about representation from HHSC.
Great.
Any other questions or comments on the early childhood data roadmap work group? All right. We look forward to the first meeting, and we'll have updates at our next called meeting of the Early Learning Council as this work group progresses. So we will jump to our next agenda item, and that is a stimulus funding update. And kicking off the update is going to be the Texas Workforce Commission and Allison Wilson.
Good morning, soon to be good afternoon. So Allison Wilson with Texas Workforce Commission and the Child Care and Early Learning Division. So we're going to share some of the initiatives that the Commission has approved since the Council last met. In February, and our public commenter did reference this, the Commission approved the 5th tranche of new initiatives, which did, as she mentioned, that last bullet there, include an additional $1 billion that was added to the Child Care Relief Fund. So that's bringing the total amount that we're putting out directly to child care providers to $3.45 billion. We did launch the application this in March, just a couple of weeks ago, and funds are going out the door. So we're very excited to see that happening, and look forward to continuing to roll those funds out. Also approved in that tranche, there was $10 million set aside for outreach and education campaigns. So that will include some campaigns to focus on building awareness and understanding of what high quality childcare and early learning looks like. And also around our Texas Rising Star QRIS program. And also we're looking to do, based on some public comments that we've received over the last several months, looking to do some sort of outreach campaign that will also target recruitment of individuals to work in childcare and early learning. So those are things we'll be working on with that 10 million. There were also some more professional development supports that were funded in that 5th tranche, including adding some additional online trainings to Texas A&M's AgriLife platform that already has quite a few courses for childcare and early learning staff, and also some of those that currently charge a nominal fee for individuals to complete. We will be funding, making those freely available, and in particular focusing on the ones that are required pre-service training for staff that work in childcare programs. There also was an initiative funded in there, $4.5 million to go to HHSC, the Early Childhood Intervention Program. So we've partnered with ECI to fund a program that focuses on endorsements and professional development to improve child find activities, and in particular, child find activities that happen in childcare programs, because we know that providers spend all day with those kids, and they're many times the ones that identify those red flags. So there'll be a focus on working with childcare programs to train them on ASQ developmental screening and helping them understand how to identify children for potential evaluation, and then how to work with the ECI program. They'll also be working with our Texas Rising Star mentors and our infant toddler specialist network specialists. And then the last piece of professional development was skills for small business for the childcare industry. So for many years, TWC has had a program called Skills for Small Business that allows businesses to apply for funding to provide short-term training for their employees to upskill, basically. And historically, childcare businesses were not eligible for that program because childcare had its own pot of funds that a lot of professional development was already provided through. But we've taken $1 million of the stimulus funding and dedicated it to the Skills for Small Business program so that now childcare programs will be able to directly apply for those funds as well. So just for example, if a program, needs to send all of their staff to CPR and first aid training at the community college, that may be a good candidate to apply for these funds and get those training costs covered. There also was $75 million approved in the 5th tranche for childcare capacity expansion. This initiative includes a number of sub-initiatives. A big chunk of that is going to be money set aside for grants to new childcare businesses or existing businesses that want to expand. It will be limited to programs that are opening in or expanding in a childcare desert or expanding infant slots, as well as to new employer-based childcare programs. We're working on procuring an entity to administer this project for us, and they will be working with those potential new programs to go through an application process where the new program submits a business plan and works with our contractor to get it to a point where it's a viable business plan, and they'll get funding at that point to help them start up. And then once they actually obtain their initial permit from child care regulation, they will be eligible for an additional amount of money to help them during that initial operating phase when they're trying to ramp up their enrollment. So we're very excited about that. There's also funding included in that $75 million that will go towards boards, workforce development boards that may want to bring on staff to focus on childcare industry expansion, to work with their business services units that they already have that are out there working with developing businesses in the community, and to hire new staff that could focus just on the childcare industry to really help, build up the supply. So the boards very soon here, I think within the next week or two, we will have that guidance published and they will be able to apply for those funds. And then we have the 6th tranche that was approved March 8th. So in this tranche, we've dedicated over $10 million to childcare regulation to make improvements to their IT systems. So this will be improvements to their class system, which is the automated system they use to manage their regulatory activities. And a lot of the improvements will be focused on the provider portal and the provider's experience and entering data into that system, as well as some enhancements that will improve the childcare search results and that search tool that families use. And then in that 6th tranche, we also have additional funding, another $15 million to continue the business coaching for childcare programs that we have currently been funding. So that $15 million will allow us to continue providing that service free of charge through next spring into the summer of 2023. So that will be a big help as programs are especially receiving these, relief funds and trying to be strategic about how they use those funds. And then lastly, on that 6th tranche, the commission also approved an additional $500,000 for a provider cost of quality calculator. They had previously approved us, procuring a vendor to develop this calculator, but it was really sort of more focused on the report and the narrow cost analysis that we use to help set our reimbursement rates. This additional 500,000 will allow us to provide a public-facing interactive tool that the public can use. So something that, you know, a provider could go and use, that a stakeholder, advocate, researcher could use. So we're in the middle of developing that solicitation now. And then lastly, and I can't quite see the bottom of the screen there, we have the, let me go to exit full screen. The 7th tranche of initiatives, which was just approved a couple weeks ago. This puts additional funds out for direct care. So it's 314 million, as you'll see there. And this would be spread over a 3-year period. So this is the second time the commission has added stimulus funds to provide more direct care. This is in response to the fact that we are seeing waiting lists for childcare subsidy rise across the state. And so there's definitely a need there. We, spread the funding out over that 3-year period because you do have to kind of be measured in how enrollment ramps up so that you're able to sustain over time and not have to kick anybody off of the program. We wouldn't want to do that. So more money coming, and so we'll be enrolling more kids. And I think that pretty much covers what we've done since the council last met.
So one of the commenters was talking about the distribution criteria that was used to distribute the child care relief funds, specifically noting the social vulnerability index. And so within the link to the, which tranche was that in?
It was in the 3rd tranche. So I can add a link to that right now into the comments.
We did amend the amount of money and added to that, but the social vulnerability index was one of those factors that we used in the distribution. Kim.
You're going to talk longer again. So thank you, Allison, for the update. And again, kudos to you and Reagan and the entire TWC team for being creative and getting all this stuff out. It's been a heavy lift over the last 2 years, and we're excited about all the stuff you guys are working on. Of course, there's questions, right? So super excited that the stabilization grants or the Child Care Relief Fund expansion grants are going out the door. Can you talk about like the uptick of that? Is it how are you seeing the responses, and then communicate what you guys are doing to continue that communication to make sure everyone is aware and applying?
Yes, so we have a lot going on that front with this round of funds. We did a lot of communication before the funds even went out, doing email blasts through GovDelivery, press releases when the funding was approved. We've also been working with our business coaches to try to help get the word out. And our own communication staff has tried to work specifically with some local media, particularly in areas of the state where we knew that the response rate from the first round was not great. So really working hard to get the get the word out there. We continue to do all of those things to get the word out, and we're monitoring closely the number of applications that we've had come in. I can check on those. I think Kathy is on this call, so she can probably give us the most current number of applications we've processed. I will say that this time we did roll out the applications in batches because there were 14,000 of them that had to go out. And we did 3 batches over like 3 days. The first batch we sent out was all the home-based providers. So we knew that they were the ones that kind of struggled the most with the application process last time. So we we prioritized them and we got it out to them first. And we have seen a stronger response thus far from that population, which is very encouraging. We also this time, you may not recall, but from an earlier, again, tranche of initiatives that was approved, we have stood up a call center. So rather than having the business coaches trying to provide, technical assistance on the application process, we have a dedicated entity that can respond not only through email, but can also, respond through an 800 number. They can get on Zoom calls to actually see the screen and what a provider is seeing to help step them through things. And that has been very popular. So it's been well utilized. And I think that's also allowing more people to get through that application process.
Allison, this is Kathy Arwood with TWC. And so I just wanted to give you the update on the most recent data that I have from March 29th. We've had nearly 7,500 applicants. And these are people who have started their application. And as of March 29th, we had already paid out over $141 million. So I do plan to start posting the information, the high level data. At some point in April, we'll start posting that on the website so that so we can share with everybody how the application process is going.
And just as a reminder, with this round of funding, the payments are going out in 4 installments. So that 141 million that we've already paid out, that represents a quarter of the payments that those who've started to receive funding will ultimately get.
That's great news. Kathy, which website will that be on? Will be on the chalk here by the numbers?
No, I'll add a link to that one as well.
Okay, perfect. Thanks, Allison. Just make sure we can.
Page. Yeah.
Oh, the COVID page. Okay. There's so many pages.
I know.
All right, Stephanie, you have a question?
Of course I do. I have a question. So some of this is a little bit of background. So of the funds that you're listing here, it's which ones can be used for things like salary, benefits, things like that, as opposed to trainings or other kind of one-time spending? So that's one question. Of how are you tracking, like when there's an application for funds, like in this kind of case, will you eventually be able to say, of the 15,000 that got some grants, this percent used it for this use, and then therefore we'll be able to kind of figure out what the greatest need was for the future. Kathy just mentioned 7,500 so far. What's that out of a total of that are sort of qualified to apply for money? And then I guess the last question was, is there a maximum that they can apply for in this particular initiative, and parameters around what they can use it for? Thank you.
So sure. So you may have to help me remember all the questions.
Oh yeah, sorry.
The number of programs that were eligible was over 13,000.
Okay.
So in the less than 2 weeks that we've been live, more than half of them have applied, which is pretty good rate. These are not grants per se. We, as was mentioned earlier, we calculated an award amount based on a number of factors. Their license capacity, where they're located in the state, and why the location is pertinent is because we use the market rate survey data. So we use the 75th percentile of the market rate averaged for all age groups. And then we took those numbers and backed into an amount based on the number of providers that would be eligible and the amount of funding that was available. And then there are also enhancements that providers get. So plus ups, it's like an additional percentage they get if they if they're a Texas Rising Star program, or if they're not Texas Rising Star, but they're nationally accredited, if they're operating in a childcare desert, or I shouldn't say or, and if they have a high social vulnerability index score. So there were 2 cut points. If they had a score over 0.75, they got an additional 10% of funding.
Yes.
And there was another cutoff, they got 5% more. And those
0.6 to 0.749.
there you go. So, and those enhancements are cumulative. So, you know, a lot of additional money did go out to those providers that are in areas with high SVI, especially if they were quality and operating in the desert. So they don't apply to like ask for a specific amount of money. They're eligible for an amount that we've calculated using that methodology. And with this round, they're not even like requesting a certain amount of those funds. We're just paying it out. So they submit an application. Basically, you know, we have to verify that they are who they are, that they are a program that is eligible for the funds, and get them set up with the comptroller and the Secretary of State and everything so that we can pay them, issue them a check. And, you know, once they've gone through that process, then we start cutting the checks. So they'll get this first one, and in, you know, 3 months from now, if they've gone in and reported on how they spent their funds, then they'll get a second check, and so on. And so to get to your data question, which I think was the third question, or your first one really, we are collecting data from them. They will have to report to us the high level categories of how they use these funds. So it does include, it does break out, you know, if they used it for staff incentives or wage supplements or stuff like that versus using it for other types of programmatic costs. So we will be able to break that out. On these other initiatives that are not specifically the child care relief funds, we do also track for those. We actually have to report it federally each year in our quality progress report that goes to the Administration for Children and Families. We have to report a breakout of what percentage of the funds was spent on professional development. And there are specific line items for like the number of providers or individuals that received wage supplements and such. And so even when funding goes down to our local workforce development boards that they may or may not use for things like that, they have to report those numbers to us, and it all gets rolled up. So we've got a statewide view of it. Did I get all of them?
I think so.
Stephanie, I put a link, I think I put a link to the child care relief funding page in the chat. One of the things that we developed was some additional guidance on how you can use these funds to support staff incentives, you know, those types of awards specifically for staff. And so I believe the link is on that page. Isn't that where that's located, Allison and Kathy?
I think it's there. We also have a lot of information that really prioritizes thinking about staff on the childcare.texas.gov website, which I can also add a link to.
And
yes.
and Allison, yeah, and Reagan, in terms of when you have to spend the money by, is that what's the deadline for that? And the reason I'm asking also, of course, is, you know, next year is a legislative session, and you know, when you're still spending, you know, we know there isn't state general revenue money, particularly that's going into child care support the way that we're really using the federal money. So I don't know if we're, you know, still spending the money out, which is great. It's just a question of how we tell the story about, you know, some of this will have a cliff at some point when childcare will continue to have need. And I think, you know, eventually, I know you'll be good at sharing information about, you know, when that cliff will come. So we can also be very clear with legislators about, their responsibility later on to shore up to help sustain the childcare system. But the timing, I think, would just be useful to know. Thank you.
So programs can charge back to September 1st of 2021.
Okay.
And they can use these funds through May of 2023.
Got it. Okay.
Okay. The funds expire federally at the end of fiscal year 23. Now we're sending these out in 4 quarterly payments. And so depending upon when the provider applies, but let's say, they applied in April, then every 3 months they'll be receiving their quarterly payment. How long it takes them to spend it is up to the program.
Right.
But so if they need longer to spend it, they do have through the end of May.
Great, thank you.
Megan.
Just wanted to read out a question from the chat from Madison Matisse. Our providers all participated in a soft launch of the application. Is that different than the actual application? Should they anticipate another step?
No, thank you so much for being part of the soft launch. We did roll out this version to I think it was 95 providers that ultimately ended up being included in that soft launch. And that basically, we just made it available early to that very small subset so that we could help work out any kinks that were not identified during our testing phase, so that when we send it out to thousands and thousands, we hopefully had worked out as many issues as we could. So thank you for participating, and no, you shouldn't expect that there's anything additional you need to do.
And Stephanie, on the link that I put in at the very bottom, there's a paragraph that talks about how the funds can be used to offer wage supplements and one-time bonuses to attract and retain high-quality staff. To learn more about how to support your staff, please click here. And so we have a specific document talking only about wage supports for staff, because we know that that's one of the critical areas that we've heard a lot of input on. So that guidance is posted. All right, are there any other questions about any of these tranches? Kim, yes, your hand is up.
I got lots of questions. I'm not going to try to dominate. Other people, please ask questions. Super excited about the 10 million plus to go to childcare regulations to support their infrastructure, knowing that that is a system that has been needing an uplift and facelift for quite some time. So just was curious from Reagan or Dana, I know you're on the call, if there's any update on like what that process is going to look like, what that's going to include. So why don't we hold that, because we are going to have an update in just a minute from childcare regulation. So just so you know, the next 2 presentations, we'll have one from ECI and then we'll have one from childcare regulation on stimulus funding updates. Childcare regulation will be able to talk more about how they're going to use this particular money to support their efforts. Same thing for ECI. Okay, any other questions or comments for TWC stimulus updates?
Hello. Hi, it's Julita McDonald, ADFW Childcare, and I do have a comment, and the comment is to thank TWC for your hard work and dedication in getting these funds out to providers. I know providers all across Texas have emailed you guys, have called you guys, have somewhat harassed you guys in a nice way to get these funds out, but you guys have did it, and we just want to say thank you so much. We are so appreciative of you guys. So I just want to say that because I know on our end, on the provider side, how frustrated it was a little bit, but on your side, I know how hard you guys are working to get the funds out. So we want to say thank you, and we appreciate you guys so much.
Well, thank you, Jolitha. I know that we had some delays. I mean, we'd really hoped that this money would start going out in February, but as we started system testing and we realized that there were issues that needed to be resolved, that if we didn't resolve, would actually slow down the money from going out. So we didn't want to launch an online system that we knew wasn't working perfectly. So we really thank everyone for their patience. We know how challenging a time it is for childcare programs. So we were really trying to work as quickly as we could. And we are very, very happy that we were able to open this up and to start distributing funds.
Thanks.
Okay. Any other questions or comments? Okay. Then the next update, we're going to hear from Sharon Stone from ECI.
Hi, everyone. I'm Sharon Stone. I'm the manager for policy and support at ECI. I'm here on behalf of Dana McGrath, who couldn't attend today. And I just wanted to provide an update on a little piece of the funding that Allison talked about. ECI has been approved to receive $4,545,000 in funding from the Texas Workforce Commission. And this money will be used to support 4 initiatives that should strengthen ECI's partnerships with childcare. And HHSC will be using this funding. We will have through July 2023 to work on these 4 initiatives. The first is to deliver trainings to child care centers in either individual sessions or regional sessions that bring together several centers. And the trainings will be on topics like early brain development, developmental red flags, working with ECI providers, as well as other topics. Second, we are in the early planning stages for 4 one-day joint training conferences for ECI and childcare program staff to foster dialogue and also to receive training on inclusion. Third, we will have funding to support 100 ECI personnel and 100 Texas Rising Star mentors to attend Train the Trainer seminars on the Ages and Stages questionnaire so that they can then train childcare providers to complete developmental screenings using the ASQ. And then finally, this funding will support about 265 ECI practitioners across the state to receive infant mental health endorsements from first 3 years. And that will strengthen our providers' ability to support child care center staff in meeting children's social emotional needs and in managing challenging behavior. And we are really excited about this project. We know that partnering with child care centers is critical to the success of ECI programs and also to ensuring that kids with developmental delays and disabilities are referred and evaluated as early as possible. And we also recognize the need among early learning staff for the types of trainings and supports that we're looking forward to providing. That is my update. I'm happy to take any questions.
Becky.
I know that our program at University of Houston Clear Lake, we're in the process of going through shared governance to get approval for an ECI certificate and an ECI minor and an ECI certificate. And Elizabeth Beavers is one of our partner faculty members, and that'll be tacked on. It's at the undergraduate level to our Bachelor of Applied Science program and our Bachelor of Science in Early Care and Education, and also anybody from outside like psych majors and stuff take it. So does that type, that it's to have more people to be able to work with ECI as early intervention specialists and things. Does that come into any of this that would be money, scholarship type money or anything like that for students at the university level who are studying these, taking these certificates or minors or anything like that?
This funding would not go to support students who are working on a specialization in ECI. This funding is really more about supporting current ECI professionals' work with child care centers and assisting child care providers in recognizing delays and disabilities and making referrals to ECI, in supporting infant mental health services in child care centers or infant mental health, just supporting child care staff in supporting children's infant mental health. It's really, none of this is earmarked for students who are potentially earning an EIS credential.
All right, other questions or comments? And June, I see your comment in the chat. We agree this is going to be an awesome partnership. We're really looking forward to this.
We are
Stephanie.
as well.
Yeah, I would just add, this is wonderful. And I think part of the reason we're excited about it is that the referrals typically from Texas Child Care to ECI, should probably be higher, compared to, mostly it's pediatricians. Obviously, you don't need a referral to get to ECI, but I think the child care numbers have been lower than we would have hoped. So I think this training will really help. And also, there is an effort in ECI, which Sharon knows, to really improve child find. And there's increased targets now at the state level around child find. So I think this probably will help also. And, it would be great, Sharon, as you talked about early childhood mental health, for us to learn from this funding and the partnerships about what's really worked on the early childhood mental health side, the capacity that's needed in childcare beyond, what this partnership will provide, because there's a lot of interest and questions about how to improve access, both for the caregivers and for kids, to improve, the experiences of young kids. So I look forward to, I don't know if you all will do a report at the end about lessons learned or what the child care centers really benefited from, but I think that'd be really helpful.
Yes, I believe we will be doing a report, and I'll make a note that would be important information to include. And I'll add another area, like you mentioned, referrals from child care centers are probably lower than they should be. Referrals for kids who are showing delays in social emotional development are also probably lower than they should be. So we're also hoping that this will help staff across the field, both in ECI and in child care centers, to recognize social emotional delays or social emotional struggles that should result in a referral to ECI.
Yeah, and Sharon, on that note, I think, one of the challenges, right, is that ECI eligibility doesn't cover all the social emotional development issues that it once did years back. So where those referrals are going, for the kids that are ineligible for ECI would also be, or is there a gap in services once kids are identified?
Right.
That'd probably be helpful to know too. I know ECI is interested in that.
Yeah, and we do have some capacity to enroll kids with those social emotional delays, and we are hoping that also through this effort, sometimes ECI staff in the field aren't taking advantage of some of the systems we've set up to allow those kids to be enrolled. or to qualify for ECI. So we're hoping this will support that effort as well.
All right, any additional questions, comments for Sharon?
Hi, this is April Crawford. This is very exciting. I think all I want to do is kind of call attention, Sharon, to the state infant and toddler specialist network is also operating out there in the childcare space. And we've partnered in the past with ECI to develop videos for administrators and practitioners to help them understand what the kind of roadmap looks like and the importance of early screening. And it's actually been an area in the ITSN work where people are really, they want this information. It's been highly valued. So we have a series of webinars around this, some of it featuring ECI content. So I think there could be a good opportunity here for the ITSN to support this initiative with dissemination through the network to childcare providers, both kind of to get the word out around what you're trying to achieve. And also if you have specific resources or documentation that you want providers to have or practitioners to have, I'm pretty sure we can support you with that dissemination too.
Great, thank you. I've made a note of that. I'll share it with Dana and we'll definitely look into that. Thank you very much. And I see there's a question about how we'll market the training to childcare centers and if we're anticipating a high level of interest. And will there be an incentive for participating? We are in just the early planning stages of all 4 of these initiatives. I can tell you on the first initiative, we will be providing, these funds will support ECI contractors to provide training to childcare centers. So our local contractors themselves would be reaching out to childcare centers to provide that training. As far as the conferences, as I said, we're in the very early stages of planning these, but we will definitely be working with Texas Workforce Commission and Texas Rising Star to promote these conferences. And we're hoping that there's a high level interest. We got information from Workforce Commission that lets us know what sort of topics might be of particular interest and importance to childcare providers. And we are still working out exactly what the training will be at those conferences. As far as incentives, there's for childcare providers to attend. At this time, we don't have specific incentives for providers to attend other than providing CEUs. I don't know if Workforce Commission has other information on that, but that's not built into this funding.
Additional questions or comments?
I see there's one more question about whether the goal of the funding is to get more people to go through the endorsement process with first 3 years to build up the workforce in early infant mental health. That is one goal. Just getting more early intervention staff endorsed with, and having a strong background in infant and early childhood mental health is one goal. The other goal is for those staff specifically to be better able to support childcare providers. And I see there's, is there a way to get a list of the point of contact for each county's ECI contractor? I can go grab and post our website for finding who is the ECI contractor. You can look it up by city, by zip code, or by county. So I will post that information in the chat.
All right. Thank you very much, Sharon. Great update.
Thank y'all.
Okay. And our next update from childcare regulation is from Dana, whose name I'm going to pronounce correctly this time. So Dana, we're looking forward to your update.
Thank you. I'm glad to be here this morning or this afternoon now, and it's good to see some familiar faces. My name is Dana Perez, and I'm the director for the unregulated operations team with childcare regulation. So I wanted to speak specifically to how we will be utilizing a portion of the childcare capacity expansion funds. We are very excited to have this opportunity to utilize some of this funding to be able to push forward some of the work that our team is currently doing to expand the childcare community. So we will be hiring 5 new temporary positions, which we are calling navigator positions, which will assist prospective and new childcare providers in understanding the rules and regulations, requirements for obtaining a permit with childcare regulation, understanding how local ordinances might impact their ability to provide care. Also, a big and main focus will be helping to guide them to resources to help them to be successful and for them to build sustainability within their programs. So we are currently working on the contract with TWC to be able to transfer the funds and get started on this as quickly as possible. We definitely want to take advantage of the time that we will have with these positions to do some really great work. I think we can all agree, we are in a dire situation when it comes to childcare availability, especially in the childcare deserts. So focusing on those areas, my team has done a really good job of getting into those communities to better understand what are the needs. Is there childcare utilization that we need to consider? Where are people going to childcare? And so making those great connections so that we can have these navigators jump in and build those connections as well and be a good resource for providers. We're really hoping that with these positions, we can identify some efficiencies through the process, because at times when people apply, specifically home providers, their applications may be returned because they are not complete. So being able to work with them closely during that process so that whenever they submit their application for the first time, it looks good, we're able to move forward to get their applications and permits issued timely. We are working on the job descriptions. We've got a good draft and we're having those reviewed. So we'll get that going. We've identified that we're going to have put these navigators in the different districts of childcare regulation. We have 4 different districts, and then 1 will be assigned to my team to kind of lead the initiative. So it's going to be a really, I think it's going to be really positive and be a good step forward to support the work that we're doing to expand the provider community. As I said, there will be working on application support, resource coordination. We will also be collecting data to see the progress and see how the efforts have made a difference, to be able to just see how well it has worked, and provide that data back to TWC to share the work that we've been able to do. And for Kim's question that she had earlier, I'm sorry that I don't have specific information related to how we are going to be using the additional funds for improving the childcare, TX Childcare Search website. I do know that they are working to, of course, make it more user-friendly. As you know, if you go and look, it's really hard to navigate. And so that has been a really a strong point in using those funds, and making sure that it is user-friendly and parents are able to search for childcare and have the ability to locate childcare that's available in the area that they're wanting it. So I will reserve comments related to that project for Rochelle when she's back, because she'll have more information to share regarding that statement of work that's being drafted.
Thank you, Dana. Kim, I will tell you that in the 6th tranche discussion paper, there are some examples of some of the enhancements that they will be pursuing. One of them is adding the Texas Rising Star status within their system, which I know we're really excited about. But there are several other enhancements that are outlined in that paper as well.
Reagan, do you know if, and I'll take a look at it again. I read it whenever you guys posted it, but it's been a minute. Do you know, is it specifically this update is only going to be on the parent facing, public facing piece and not the internal tracking that licensing reps use and where that data is collected for visits?
It's both. It is both.
It's going to be both. Okay. Okay. That's good to know. Okay. Thank you.
All right. Questions or comments?
Can I just ask one little question, Stephanie?
Of course.
Dana, for this navigation help, is the goal to, or are you kind of agnostic as to whether the childcare folks who are looking to get in to this world, whether they're in the regulated or in the licensed category? Is this help targeted to any of those? Is part of the goal to encourage license and then be part of the subsidy program? Or is this, basically just some resource support as they get going?
Well, certainly it's to encourage any provider to become regulated first and foremost. But I think on the other hand, we want to promote becoming registered and licensed because they would then have the availability and access to more resources, and then have the option to look into the Texas Rising Star and the quality childcare piece. So that's definitely what we're promoting. But at the very least, we want to get them in the door, get them regulated, and then through that, maybe they determine that they want to expand and grow through that process as well.
Okay. Thanks.
Can I ask a follow-up question?
Sure.
So I know you will have more information when you get these 5 navigators out there, but what is your take, or is there data somewhere on, as you guys find the unregulated, unlicensed care now, what is the uptick that you're seeing them? Are you seeing more of them, they just close, or do you see more of them join and become listed and regulated and licensed?
It's really a mix. It kind of depends on the frequency that they're providing care. If it's something that they're actually doing as a business, where we are seeing them applying and obtaining a permit. If it's something that they're just doing periodically, and even though it may be subject to regulation, they may decide that that's just not the way they want to go. Like they were just doing it to help out a friend, and it didn't seem to be a long-term commitment. Then they may determine that they want to close. We are striving, though, to really encourage them that, even if this is not something that you see doing long-term, maybe this is, encouraging them to apply and obtain that permit so that they can at least offer that service to their community for the time being.
Yeah, and I'm assuming the majority of them, what you're finding is homes versus centers.
We are, yes.
Yeah, yeah.
We do want to also consider, though, centers, especially in the childcare desert areas, to see if they would be open to expanding and increasing capacity. So working with them on identifying, is there space available that they aren't aware of, just exploring different options.
Yeah, we did a open records request for childcare closures throughout the pandemic, and we are on the cusp of getting that out to everybody. But from the bird's eye view, the family home providers closure rate is much, much higher than the centers, which isn't really a big surprise to any of us. So we're anxious that our data people are scrubbing the data now. So we should have some good reports out to everybody we can really look at where those holes are and where those new deserts are and what happened with that. So stay tuned for that. So
that sounds great.
Okay, and I see a comment from Teresa. in the chat as well on their observations as they're reaching out to home-based providers as well. And one of the things, I mean, I certainly, you know, we always want to encourage people to participate in the child care services program. I will say that Allison mentioned that we're investing. So in fiscal year 23 and 24, we will be putting out an additional $260 million into low-income childcare. Our commissioners approved a base allocation of $1 billion. And you add the 260 million to that, we're putting out $1.26 billion for the child care program, a very, very significant number when you think that a few years ago we were around 600 million. Then we bumped up to 700. Anyway, it's a lot of money, which means we can serve a lot more kids. And so as childcare programs are coming up, particularly in deserts where it's so hard to find childcare, we always want to encourage providers to become part of the subsidy system. I'm really hoping that with these additional resources, we'll be able to serve many, many more kids in the next 2 years. Of course, that all goes to the cliff and what happens afterwards. But at least during the time that stimulus funds is available, we'll have a lot more opportunity to help more families. All right. And if there are no other questions or comments, Dana, thank you very much. And that takes us to our next agenda item. We've got updates from our council members. And first on the list is Dr. April Crawford. April.
Hello. Okay, I'm going to run through some of the slides that have been presented from the TechPed's Early Childhood Professional Development System report. We put out our first State of the Early Childhood Education Workforce Quality report a few months ago, and we had a session that's recorded if anybody wants to, you know, kind of take a deeper dive into it. And then we also have a link here so you can actually find the full report if you'd like to look at it. I apologize. I have my cameras on a very small screen, so I've got to look at slides on a big screen. So if it looks like I'm not talking to you, I'm trying to talk to you, but I'm also looking at slides. So just jump in if you want me to back up or if you have questions as we go along. Okay, so this is the QR code where you can go to find more of this information. Just kind of high level, what we've done here is we've presented the first report from TechPeds that tells us who the users are, what their demographic characteristics are, and we've mostly taken a deep dive in this first report into professional development and training data, because that's where we have the most complete and validated or verified information. And the idea is this is sort of report one, and that over time, as the data becomes more robust, we can report out on additional areas and start to look at trends in a lot of these things over time. Next slide. Just at a high level, just to make sure we all know what the Texas Early Childhood Professional Development System is. It's a technology platform, and it also has a lot of content that lives on the platform. There are two major components, technology components. One is the Texas Workforce Registry, which is where individual workforce members can have a record that they own of their professional, their career essentially, and it can include their workforce experience, their education, and their training history. And then there are some additional variables and things that are optional fields, things like your wages. There's a lot of potential to expand this to collect other data elements that stakeholders in the state may want to know, but that aren't currently part of the system. So for example, we've done some piloting with things like collecting occupational versus job turnover. So where do they go? Because these records are owned by the individuals, we can reach out to the individual even if they leave their current employer. The Texas Trainer Registry is a system for approvals of trainers. There's multiple levels of trainer approval, and at the highest levels, we're working right now on revisions to this system that will bring more of a competency framework to the highest level of approval. So I'll talk a little bit more about that in a minute. And then there's two kind of content tools that really are central to TechPeds. One is the state core competencies for practitioners and administrators. and core competencies for trainers and coaches or mentors. So, this kind of content is what we should see infused and reflected in training and educational experiences for the workforce. And they're also the competencies that we hope individuals in the workforce seek. And then there's career pathway content and tools that help what are the kind of next steps in the career pathway if you want to stay in this field and make progress in this field. Next slide. This I'll go through real high level. I just want to share this with the council so we all have the same big picture sense of how a system like TechPeds can support our long-term goals. So starting on the left, the target here is practitioners, administrators, and specialists in our workforce. And the data collected pertains to the birth to 8 population right now. And resources going in are those things I just described on the last slide. So the core competency frameworks, career pathway tools, and the platform itself, which is a secure record storage system. And it also has real-time reporting connected to it. The key inputs or activities of the TechPeds system staff and in the field are to build out these personal profiles that document an individual's professional career, including their education, training, and work experiences, and then career advancement tools. And the Texas Trainer Registry is the other core input, and that is that review and approval system for high quality training in the state. There are some other tools that we really hope we can build awareness of through the council and through the organizations that you all work in. These tools are things like the certificate generation tool, which is it's built to make it free and easy to get certificate data into the system. So, the initiative we just heard about with ECI, it would be fantastic if ECI would consider issuing their certificates in a standardized way on this platform. That way, all of the training that they do in childcare is automatically loaded into TechPeds and into individuals' workforce profiles. Then there are trainer and training search and location tools to help people identify quality trainings in the areas that they're looking for. Some intermediate outcomes for the system are that the profile reports guide career development and advancement decisions. The workforce reports can guide state and local investment in quality improvement efforts. The system's designed to really help organizations and agencies streamline record review. And the system's also designed with a series of validation tools that help us increase record accuracy. On the training side, improvements in the quality of available training, that's an important short-term outcome. Increased awareness and access to high-need training topics. And the hope is to standardize and streamline professional development certificate data. So we're kind of looking at apples to apples in the state as individuals go through training experiences. And then our long-term goals, hook up with the broader system's long-term goals, which is a highly qualified workforce, improved system coordination, and improved early learning experiences for children and families. The next slide. Now I'm just going to kind of dig in and show you some of the data that came out in this first report. So what this is showing you is just growth in users. And this is largely attributed to some state and regional partnerships that have really built awareness of the system and have incentivized use of the system. And in some cases, programs have actually made TechPeds use a requirement for participation in programs. And that's really what has led to this kind of large increase in utilization in the state. So if you look back at 2013, on this chart, what you're seeing is the proportion of accounts that are for administrators versus practitioners. We see way back in 2013, the system had 3 administrators, got started with 3 administrators and 2 practitioners. And then you can see just incredible growth over time. Around the period where you start to see a huge amount of growth, accounts were made free. There were some important state and regional investments from Tarrant County in the tools on the platform. As you see continued growth around 2019, 20, 2020 and 2021. You see that largely reflects some changes in ease of use for the technology, but also in TWC's decision to use TechPeds as a tool to support Texas Rising Star assessment scoring. So where we are right now, it's, you know, we have more users now than we did at the time of this report, but today we have 4,148 administrators on the platform and 61,207 practitioners on the platform. So it's really become, you know, we're at a point now where we have enough data on enough of the Texas workforce that we feel confident starting to release these reports. And, you know, so we're sort of just now at the point where we feel like we've got kind of a critical mass of data to be able to do this. Yeah. Okay, so this slide, who are the users in TechPeds? TechPeds is designed to hold data for all of our program types in the early childhood system. So we do have users from Head Start, public schools, child care centers, family child care, kind of the whole range of program types are represented here. I'm going to kind of start just to orient you to the chart because I'm sure it might be small for you too. On the left, these are 3 of the demographic types of categories we collect data on. And in the middle, these are the counts and percentage responses for administrators. And then on the right, the last 2 columns are focused on practitioner responses. So what we see is about 53% of the users reported their race and ethnicity, with the largest demographic groups being Hispanic at 20%, followed by Caucasian at 13%, African American at 10.8%, and multiracial at 7%. The next sort of block of content here is educational attainment. And you can see there on the left, the categories of attainment that we collect on the system. About 30% of administrators reported their educational attainment. We see that 7.2 have a high school diploma or GED, 4.9 an associate's degree, and 8.5 a bachelor's degree. And only about 20% of the practitioners reported this information. The most reported level of attainment is high school diploma or GED at 6.3%, 2% with an associate's degree, and 4.5% with a bachelor's degree. And then that last block that we're sharing today is program setting, where we still have a lot of missing data. 20% of administrators reported their setting, and 31.2 were from child care centers, and then much smaller numbers coming from each of the other program types listed. And about 20% of practitioners reported the setting they work in, where the most common was child care centers at 15.5%. So overall, these data are most representative of providers enrolled in the child care subsidy program and providers that are part of Texas Rising Star. The kind of greatest concentrations of data across the state at this point are from the Gulf Coast region. About 15% of the records come from Gulf Coast. About 10% come from Tarrant County. And then about 5 to 7% each come from Capital Area, Alamo, Rural Capital, and Upper Rio Grande. So what we're really seeing, you know, you can see here that we really want to make sure that we're transparent. There's a lot of missing data here. There's still data on 10,000 workforce members, which is more than we've ever had before. So that's why we want to start sharing the data and the information. I think if you were to kind of think of a parallel in survey work, you would certainly feel like if you got 10,000 responses from the field, you'd want to look at that data. But we still just do want to really caution people about generalizability of the data that we can share at this point. We're most confident in the data for people working in centers enrolled in the child care subsidy program and centers and practitioners that are part of Texas Rising Star programs. Those are the 2 kind of populations that we think we have the most thorough data for. The next slide, I'm just going to kind of quickly dive into some of the training data. The training data is where we have the greatest concentration of validated data. So I want to spend a little time showing you the types of questions we think are going to be interesting as stakeholders dig into this information. So, big picture, we house work experience, education, and training data. And these next few slides are really just going to drill down on some of the training data. So, and this is data from, we have approximately 54,000 people in this initial report data set, and about 9,500 of them shown here have training data that can be verified. So that's the population we're reporting on here. So it's a subsample of registry users that's, close to 10,000 people and around 70,000 records that can be verified. Let's see. So kind of as we drill down, the one thing I want to note here is we're showing you everything as an aggregate, like as an averaged experience across the workforce. And, that's going to be great long-term for us to look at trends over time in what's happening. But these same data can be drilled down in a regional way or in an initiative way. So if you're working in a particular region and you really want to sort of target certain elements of training or improvements in training supply, you can use these data in a more local way to answer those kinds of questions. And the other things that I think are going to be interesting over time is these data should become really useful for any kind of evaluations that we might be interested in, where you want to know, did participation in specific types of training experiences lead to better outcomes, a broad range of outcomes. Could be better outcomes in terms of how you interact with kids, could be better outcomes in terms of retention and turnover, lots of different outcomes. But I'm going to show you kind of aggregate level data. So with this one, can you go just back really quick? Let me just tell. So what we're really looking at here is clock hour training. The system captures clock hours, continuing professional education units, and conference hours, but we're going to focus on the clock hours trainings. So the most interesting thing to see here is that the total number of training hours typically exceeds state requirements. And during the pandemic period, there's this shift where administrators are spending less time on training and practitioners are actually spending more time than usual on training. And that might have something to do with sort of the amount of time that they were out of class because there weren't kids to care for, so they were engaged in training. And it might also reflect some increased requirements for COVID-related training during the pandemic period. The next slide is really focused on what's the core kind of content focus for the trainings that our administrators are participating in. Along the bottom, those are the major categories of core competency and expectations for administrators in the state. And what this chart is showing is that over time, the two most common areas for administrators to spend their time in training is in the areas of safe environment and curriculum and environment. So this again will be kind of interesting to look at over time. And it's a place where, let's say there is an interest in really, you see a little uptick from 2019 to 2020 in things like organizational development, so things like, the heavier emphasis on business coaching coming into the picture and greater availability of access to things like that. What'll be interesting to see is to what extent we can kind of target specific areas for growth in training opportunity, and then looking longer run, how did that impact quality? The next one is just showing the focus for practitioners. And what we see here really is that the two most common practitioner competencies are child skill development and child growth. So again, you could imagine that, let's say we feel like we really want to see in our state more people have training in dual language or English or EL topics. That this kind of data over time can help you understand to what extent your workforce is exposed to and participating in trainings that cover these important competencies. The next slide is here we're asking what's the learning format for the professional development opportunities TechPeds users participate in. So the left side of this is showing you learning formats for administrators, and the right is showing you learning formats for practitioners. And what learning format is really starting to get a better sense of our professional development experiences. We largely think about documenting trainings and workshops. But in reality, people participate in a broad range of training over the course of their career. So conferences, individual coaching and mentoring is something that's largely undocumented in most states and programs. We have certificate tools that make it really easy to document this kind of contact and training. Online modules, PLCs, professional learning communities is the term for that. Those are small group-based sessions. Self-study, workshops, and webinars. What I think is interesting here in this kind of early reporting is the increased use in online modules among practitioners and an increase in webinar participation among administrators and practitioners. We see pretty dramatic increases in those, and they're probably related to the pandemic. So it's going to be interesting to see if that holds or if we see people kind of slide back toward more in-person, less online types of contact. And then the next slide is showing the delivery types. And by this, what I really want to highlight is just the distinction between receiving in-person support and training versus something that is like an online or distance learning opportunity. And again, here we're seeing an increase in online training. And we saw this increase even prior to the pandemic period and prior to what's reported here. But in the pandemic period, the increase is really, really clear. And it's going to be interesting again to see, is that where we're going to stay? Have people sort of like gone online and they're staying there? Or are we going to see people return to some of the more traditional and more in-person learning opportunities? The next one is the training methods that are being used to support the workforce. And again, this one, it seems like it's a subtle facet, but it's a difference. This is the extent to which there's an instructor leading the learner, whether it's online or in person, or was this done in a way that's self-instructional? And what's happening here, we think, is that there's likely an increase related to the pandemic that pushed more people into self-instructional and online courses. So we see that we don't really see that happen for administrators. We don't see a lot of movement of them to self-instructional at a high rate. But for the practitioners, that's a pretty significant bump in the time they're spending without an instructor guiding their learning experiences. Okay, so our big strategic goals for TechPeds, because this again was just the first report, our big goals are to keep increasing access to high quality early childhood workforce data. So just more data in the system that can be verified is the most important thing if we want to continue to be able to leverage this system to support the workforce. Number two is supporting quality improvement by raising awareness and understanding of the core competencies and the various training opportunities and career pathway tools on the platform. And then the third, we really think we achieve those first two goals in large part if we continue to build integrations and coordinations within state programs in ways that both support the programs to increase the efficiency with which they process and use records, but also it means more data into the system that can be leveraged by stakeholders. So those are kind of our broad strategies. And this, the last slide, I guess it's the second to last slide, Megan. I won't go into, because I think I'm probably already used my 15 minutes. I won't go into the recommendations, but we do make a set of recommendations at all levels, sort of state level, regional, local agencies, how they can better use TechPeds and promote the use of TechPeds, and also by ECE professionals and providers. There are some really targeted strategies there that we would be very happy to coordinate and work with any of you in your organizations to help kind of get the word out on how this can be done. The tools are free to use. It's usually an issue of building awareness and We routinely make adjustments to the system in response to what stakeholders need from the system. So I'd really love for you all to view it as an opportunity for partnership. And then the last slide, this is just where you can go. We do have, in addition to the aggregate reports I shared here, you can look at raw data by region if you follow the link here. Just keep in mind it's raw data. So, you know, it is literally as users put data in, it's de-identified and shared with you through this system. You can always reach out to us if there's a refined way you want to look at the data and you have specific questions you want to answer, and we can help you. Hi, Becky. See.
Okay, thank you very much, April, because as somebody who has done research in the early childhood workforce on, I have a couple articles. I had an awful time when I was writing my articles to find good information on the early childhood. It was from the Ransom Center back in 2015 or something. And I don't know if that was from the original Early Learning Council that produced that, but it was very vague. I mean, it was good for the time, but I really had a hard time because you have to be able to put data in there. So this is also going to help researchers, and it's going to help people to know more about you know, faculty members, people that are doing research on the workforce is another constituency that maybe you might not have thought as much about, but that is true because there's not much out there that gives these type of data to be able to back up what you're saying, you know? So I want to thank you so much for that.
Oh, thank you, Becky. Yep, that was a hope for us too, is that we could improve accuracy in what we're able to say in research publications.
All right. Questions or comments for April Alferma?
April, as you were presenting, I began to think about the salaries of the early childhood workforce, and I was wondering, has any thought been given into including some salary studies in these reports? Because I think that's very important. We often receive requests for salary studies in our state, and there aren't very many. I think if I recall, the last one I remember, maybe 2013 or something like that. But it would just be very interesting to see from this, even in TechPads, maybe some type of salary study on the workforce who participate in the TechPads, even administrators and practitioners, because I think it would be, I don't know, I was just thinking about it as you were presenting. I said, you know, it may be a good thing to just see where they are salary-wise, because we know that there's such a disparity. But just a thought, and I just thought I would just run it by you.
Yeah, that's definitely, Alferma, thank you. That's one of the strategies we have in the recommendations is we really think now that we have 60,000 workforce members that come to this system, it's actually the perfect place to do workforce studies and surveys, so that's absolutely one of the fields that we think should be part of a special collection. And I feel the same way about workforce turnover versus occupational turnover. I would love to know if these workforce members, when they leave their job, did they really just leave their job or did they leave our field? And because we have, this is their repository, the contact information is not connected to their employer. It's connected to the individual. So it provides, I think, a really, really unprecedented opportunity to request data from the workforce on a scale that we haven't been able to do before.
Thanks, April. Great report. On the demographics that isn't collected or that missing information, what kind of, and I know we have to be careful, like what we require demographic wise. When I was over at Texas ARIC, we had to be careful what we had to require members to report versus, not required, that red asterisk. What kind of conversations are happening, or who has the, is that just something you guys can decide on what is a required field versus a
TechPads has an advisory council, and any changes to like actual requirements and data elements we bring to that advisory council for discussion. So that one is an optional field. Almost before going to required, I think it's valuable to consider a special collection where you ask people more explicitly for this information.
Okay.
So what happens is a lot of users will come in and they'll fill out the particular fields that are most important for their current, you know, let's say let's say they're a Teach Scholarship recipient and they're asked to provide specific information to satisfy the Teach requirements. You know, that tends to be what they do. They come in and they report what they've been asked to report. But I think the opportunity here is for special collections, maybe on like an annual, semi-annual kind of basis, where we say, look, let's do a push, and in a way that's really easy for users to share their data securely. Let's not ask them to go in and update their entire profile and their entire history. Let's ask them for a few key pieces of information that would really be meaningful to stakeholders, and see what we get. You know, we've been really pleasantly surprised when we've used this as a tool to survey people during COVID. You know, thousands of the members will respond in just a matter of a few days. So it's, you know, I think there are opportunities pre-requirement, but I think if a state entity needed this kind of information, let's say to enhance federal reporting, I think those are the types of things where the advisory council would say, okay, look, you know, there's a clear need. This will benefit, the state will be able to better report out on, you know, utilization, service, and uptake if we include this variable as required. I think that's the kind of conversation that would largely lead us to change a field from optional to required.
Thanks.
One other, went the other way. The thing that I'm interested in, you were saying your training that you're collecting is only clock hour training. So I would suggest that you add a category to see college credit. Because as students are taking different associate degree or even, you know, CDA, which can be credit bearing, or bachelor or master's, that's important information, because especially that the you know, NAYC pushing people toward more of a bachelor level thing, but people are in progress doing that. Some people have some clock hours and not, but to concentrate also on credit bearing types of coursework that they have, whether it's certificates or whatever that are at the college level that they're getting actual, because that could be very helpful also to universities. And also we do have deserts as far as areas where people can get early childhood credentials or whatever in the state. Not everybody offers these courses. So that could be very helpful, I think.
I agree, Becky. I'm glad you brought that up. We actually do collect that. So we actually take in transcripts, and then we also have sections for your certifications or certificates earned. And then we have sections, we have some specific reporting tools that specifically look at your early childhood development college experiences and hours spent in that area. So those are in there as part of the education block, because that data is again, the training data is what is most complete right now. And that's because the programs that have been partnering with us, the training data has been really important for those programs. But the formal education block of fields, I'd be happy to share that with you and get your feedback. You know, if you think there are certifications or certificates or areas of specialization that we aren't currently breaking out that would be helpful, you know, I'd love to hear it.
Okay, thank you.
So I've got a couple of comments. Allison had mentioned some funding that we approved for AgriLife online trainings, but one aspect of that was to create an ongoing connection between AgriLife and TechPed's workforce registry. So we're excited that those trainings will now automatically link over to a practitioner's workforce registry. In fact, during our commission meeting, we actually had a public commenter comment specifically on how excited they were about this connection. So that was nice to hear.
Oh, that's great to hear. We're excited too. That'll, and just, you know, for the kind of broader conversation. So CCEI and CLI Engage, and now soon AgriLife, you know, those training organizations make up a large proportion of training that happens in the state. But the more we can get organizations onto the dashboard for TechPeds so that they're issuing and automating their certificate data to transfer in, it's a huge benefit to the workforce members. You're reducing the lift for them to get information into this system, and it really increases accuracy and standardization of the information in the system. So any of you who work with trainers or training organizations, we would love to help you learn to leverage the organizational dashboard tools so we can kind of build this data together.
Yeah. We also have the House Bill 619 childcare workforce strategic plan efforts that are underway, an advisory council on that. So we'll be collecting a lot of data around the workforce, and that we have information posted on our website under our stakeholder engagement section, but that advisory council meets, their first in-person meeting is a week from today, I believe. I also wanted to mention that the Texas Policy Lab at Rice is also working on an evaluation of the childcare workforce. And so I think we can, if there's interest, we could kind of put on our to-do list, getting an update from them when their report is getting closer to completion. They were actually using some UI wage records that they got through a data sharing agreement with the Workforce Commission, looking at turnover within the industry and doing some comparisons to other industries. So we can certainly see if they can provide us with an overview at an upcoming meeting. Okay. Any other questions or comments for April? Okay, thank you very much. Good update. Okay, so our next update, we're actually going to have Megan give us an update on our new early childhood website.
Great, thanks, Reagan. Megan Schneider. I am, as y'all know, the facilitator of these council meetings. I'm also the interagency director of early childhood. So I'm at Texas Education Agency, but I work across DEA, Health and Human Services Commission, Texas Workforce Commission, and Department of Family and Protective Services. And so one of the initiatives that we had given updates here and there to y'all about over the course of the last year was this one-stop shop website for existing state agency resources that is parent-facing and puts all of our great stuff in one spot. And so that is now launched, as you might have heard, as of early March. And it combines all of the agencies you see listed at the bottom here, who I work with, in addition to other agencies that just have information that's relevant for families of young kids. And the whole point was to make it more accessible, make it more available, help show people all the great programs and services and documentation and resources that are already out there, and to not structure it by agency. So you don't need to know where a program or a resource lives within our different silos. You can access it all by the content area. So the website is structured across the four categories you say listed there on the slide. So health and development, parenting, childcare and education, and then eligibility programs. We are a little tight on time, so I won't do kind of a show and tell, but I will drop the link into the chat. I'll include in an email follow-up to the council some promotional materials. So you're welcome to kind of pick up any of that newsletter blurbs or content images to help promote the website. And myself or any of the website team that helped curate this content and get it launched is more than happy to come and do kind of a show and tell and walk through at any of your organizations if that's of interest. So just feel free to reach out to me. And for members of the public who don't receive that email that goes to the council, please feel free to reach out to me. I'm happy to share that promotional content with y'all as well. And so with that, I'll pass it back to you, Reagan, and I'm happy to answer any questions.
All right. Questions or comments right now? Okay, so The next couple of things we're going to do are updates from members. So if we have any updates from council members, generally under agenda item 6, and then we'll be talking about some upcoming early childhood events. So let me first see if any council members have any other general updates that they would like to provide. Becky.
Yeah, this is just FYI. We just, this week our University of Houston Clear Lake underwent NAYC accreditation for our bachelor's degree, Bachelor of Applied Science, Bachelor of Science in Early Care and Education. So the team was on our campus, and Kathy Abba, I think, was there as one of the outside, the stakeholder people. But if we get accredited, then we would be the first bachelor program in Texas, early childhood bachelor program, to be accredited by NAYC. So I just wanted to let you know and to be aware that this is upcoming. Hopefully, usually the commission meets around June that makes a decision. The people, actually, the team that evaluates, they don't make the decision. They just give the information to this commission and then they make the decision. But so we're real proud of all the work we've done, and our team, have to give credit to all our early childhood faculty.
Very exciting update. So we can't wait to hear the outcome at our next meeting. All right. Any other council member updates? Stephanie.
Hi, I shared in the chat a blog by our Director of Health Policy, Diana Forrester, about the upcoming end of the public health emergency and what that might mean for kids and families that have remained on Medicaid during the public health emergency, and how many of these kids and families are going to be rolled off as the public health emergency ends, and what that might mean, and steps that we hope HHSC takes to kind of minimize the impact of that. And so I just think it's an issue that not a lot of people are aware of or know about the timelines, and it's a very critical kind of urgent issue that we're very scared about in Texas in particular. And so hopefully this blog will help people. And if you have any questions, please feel free to contact me or Diana on my staff.
All right. Thank you, Stephanie.
Reagan, I have one. This is Kim Crawford.
Okay.
Next week, we will be launching our new Quest for Equity and Quality report. So it'll hit everyone's inboxes next week. We did focus groups last fall, talking to providers both in and outside the TRS system, and got their feedback and had great dialogue and conversations. This is our report. So just as a teaser, that it's going to be hitting your inbox next week. So we're super excited this work is coming together.
Thank you, Kim. Other updates? Okay, if not, we're going to go to our final agenda item, updates on early childhood events, and Alferma Giles has an update for us.
Thank you, Reagan. I have a couple. The National Head Start Association Conference will be held in Baltimore, Maryland, May the 2nd through the 5th. This will be our first in person since the 2019 conference. So we're really excited. I posted the link to the information in the chat. And while I'm at it, I'll announce the Region 6 Head Start Association Conference. Region 6 consists of Texas, New Mexico, Louisiana, Arkansas, and Oklahoma. And Arkansas is the host this year. The conference will take place in Jonesboro, Arkansas, at their brand new Red Wolf Conference Center, the Embassy Suites. And the closest airport is Memphis, Tennessee. It's like 80 miles outside of Memphis, but we're excited. We're having our board meeting there on Monday, April 11th. So we'll be traveling there. So this is our face-to-face, and hopefully everything will go well. I put the link for that one also, so you can look at it, access it. If you're interested in presenting, you have to rush. I think the National Head Start Conference call for proposals has closed, but for the Region 6 Head Start Conference, you can still get in there. And I'm just saying that we have so much to share from our state. I encourage those of you who are interested in presenting will submit a proposal. We're excited, looking forward to it. Thank you so much.
Thank you, Alfred. I'm excited to have an in-person event after so long. All right, and then Megan is going to give us a quick update on some webinars that the Hunt Institute is offering.
Yeah, so this is on behalf of Lauren Zabinski, who, for those of you who knew her, held my role prior as interagency director. She's now at the Hunt Institute. So she says to say hello to all of the council members. The Hunt Institute, if you're not familiar, is a nonprofit that works across a variety of different issue areas, including early childhood education. And they have a bunch of free webinars. So I'll drop a link to all of these in a chat and just would encourage folks to check it out.
All right, thank you very much, Megan. Are there any other updates on upcoming events that council members would like to share?
I've got two. This is Kim Crawford again. April and May will be busy. Actually, June will be busy too, but we're always busy, right? Sorry. So in April, we will be doing our spring Texas tour. Many of you are aware that we go around twice a year and visit 10 different communities. April will be virtual. We hope to have our fall one in person, but we're going to 10 different communities across the state. We'll be talking about that report I just mentioned, as well as give you some childcare closure data, and then it's just a chance for us to meet and visit with community members and stakeholders and providers. So I will drop a link in the chat for the Texas tour, so you can sign up for your town. If we're not in your town, come to one of them because it'll still be good information. And then the other event is our annual Early Childhood Summit. It will be May 18th. That's a Wednesday, and we're going to focus on the workforce. So we have some good national and state panelists coming and joining us, and to really talk about the early childhood workforce, and then how that affects all workforce and businesses, and how do we get our workforce back to work and a place to take care of our children. So I will drop that link in. That's it for me.
Fantastic, thank you. Other events to share?
Hello, this is Julita McDonald, and I would like to share an event. My organization, ADFW Family Childcare Network, is hosting a first annual gala for early childhood educators in the Arlington, Dallas, Fort Worth Metroplex, and other providers from across the state of Texas are welcome to come. We are celebrating National Child Care Provider Appreciation Day, which is on May 6th this year, but we are celebrating on May 21st. And providers from the Dallas, Fort Worth Metroplex are putting in proclamations in their actual cities. We have Denton County, we have someone from Fort Worth County, we have a provider in Dallas County. They're all submitting proclamations to their city councils to proclaim that day National Child Care Appreciation Day. And then we're all coming together to celebrate on May 21st in Arlington, Texas at Live by Lowe's. And this celebration will celebrate all early childhood educators and the organizations that support us. So you all are welcome to come. I will send the link to Megan to send out to everyone. Thank you.
Thanks, Julita. Any additional updates from any members? All right. Then with that, it is 12:59 and this council meeting is adjourned. Thank you all for being here. Thank you, members of the public, for joining us. And I look forward to seeing everybody at our next meeting. Take care.
Thank you.